friends. Welcome back to the AuDHD Psych Podcast. I'm Howearth, clinical psychologist, and we are different, not defective. And look at my pretty yellow coat. Thank you to everybody who's listened to our previous episodes. It has been fun monologuing and chatting and answering questions from Uma and Dan. And we have Dan here again today helping me out. And we really appreciate everyone's support on our social media, Instagram, Facebook, TikTok now. And those of you who have liked, followed, subscribed, and left us ratings on streaming platforms, if you haven't already and you have a chance, please do. We really appreciate it. Or follow us on our Instagram. Last week we had a bit of a chat about impacts in different areas of life. And this week, we're sort of tuning in a little bit on rejection sensitivity and what we refer to as rejection-sensitive dysphoria. As I mentioned, Uma's not here today, so I've got the delightful Dan is giving me a hand and going to ask me questions and help keep me on track. So I'll hand over to Dan. Dan, what was our first question?
So this one's about emotional dysregulation and rejection sensitivity. Can you talk about what emotional intensity actually feels like and what's happening in your body when emotions hit?
So emotional intensity, that experience is different for everybody, as is every experience. What emotions are actually in our body in my clinical practice, when I'm trying to describe emotions to people, the framing that I use is emotions are our integrated experience of our body's response to our cognitive appraisal of our context. And by context, I mean both my past history that leads into how I perceive things now and my current context, my current perspective, the current environment that I'm in. So, for example, if I perceive a challenge in the environment, my body needs to respond to that challenge in some way. That's a cognitive appraisal to see that it's a challenge. But it could be a positive challenge, a motivational challenge, a growth opportunity, or it could be a threat, a physical threat to my safety. Or a perceived threat to my safety. If it's positive, I'll experience excitement. If it's negative, I'll experience the fight, flight, fear, fawn, or flop responses. If I cognitively appraise that I'm stronger than the threat, I'm probably going to fight it off to keep myself safe. If I appraise that it's stronger than me, but I'm strong enough to get away, I move into flight. If I perceive that I'm not strong enough to get away, but I can hide, I'll hit the freeze response and hope that it doesn't see me. If none of those are my perception of myself, if I appraise that I'm not going to get away, I can't hide from it, I'll lean into a bit of social accountability. I'll beg for my life. And finally, and here we're moving from that activated side into what we see depression underpinned by hopelessness. If I believe I can't get away, and the predator, for example, in an evolutionary sense, has got me, I'll not be there. I'll dissociate and my body will cease responding. In those first couple of activated safety responses and excitement, my body wants to do very similar things. I need to activate and move. Heart rate increases, breathing increases, and that's to get oxygen into my blood and pump that oxygen around my body, to my muscles, to my brain for thinking. There are cognitive differences that come into play. My eyes do different things. Interesting for those of you out there who experience IBS and similar gut issues. One of the biological responses to activation for fight, flight, fight and flight particularly, is digestion costs a lot of energy. And so I want to use that for the fight or the run away. So I'm probably going to stop digesting. But also, if I need to run away, I want to weigh as little as possible. So I'm probably going to try and evacuate what's in there as well. If I need to fight, I'm probably going to want that energy later. I don't need to get rid of it. So I'll have a slightly different experience in my stomach there. But that probably links into why a lot of neurodivergent people experience IBS, because it is probably consistent with our body's anxiety response. So bringing myself back on track, there are those responses that are literally our body getting ready to do something or not in response to what I see about myself in my context. How I see my current context is influenced by my past CBT core beliefs, schema therapy schemas, that type of influence on how I experience the world now. Could you ask me the question again? Because I went on a massive tangent there.
No, that's okay. I think you've actually covered it quite well. So The question was about emotional dysregulation and rejection sensitivity and the emotional intensity, what it feels like. Yeah.
So just tapping into the emotional intensity, so that will vary by person, but also, there's so many different parts to that rejection sensitivity one. I have lots of experiences of rejection in the past. Often as a neurodivergent kid, that's one of the most common complex stresses that I see. We have this current history of real and perceived rejection, to the point that we will be impulsive and say the first thing that comes to mind. One, because we're impulsive. Two, because we don't clock that you have a different social expectation about how to respond to, how do you like my new haircut that somebody did with a blindfold on? And I respond in a really direct way with the first thing that comes to mind, where you're kind of expecting me to go, oh, it's lovely, and look away to politely let you know that it's not something that I would choose for an enemy.
Very French.
I love that. It's good, by the way. But so I get lots of these experiences. They teach me to read ambiguous situations through that same lens of negative feedback. They prime me to see that negative social feedback and to not see or to dismiss the positive social feedback. So I then wonder where I was going with that. I'm then more likely to experience that social rejection. I take it into my now. But then if I have some interoceptive differences, like many neurodivergent people do, which probably contributes to alexithymia, that I think before recording, you and I have heard this stat about a million times because I keep repeating it. I think 50-ish%, around half of neurodivergent or autistic kids in some research have been found to be alexithymic. And between 30 and 70%, I think, was the range of adults experience alexithymia, which is, well, thank you for asking, Dan. Alexithymia is difficulty in the experience of emotions, often in naming and identifying the emotion, which changes the way we experience and express it. So if I don't understand, if I can't name, if I don't know what it is that I'm experiencing, it's much more difficult for me to rein my emotions in. If I don't realise that I'm becoming super anxious until I reach panic, then I'm going to go from apparently calm to panic really suddenly. If I'm an AuDHDer and I'm also emotionally impulsive for whatever reason that is, that's going to be amplified. Then if I've got a history of social difficulties and if I'm suddenly really angry for no reason to everybody else, it's going to amplify my social difficulties and my predisposition to those emotional difficulties that we just described through that process. So what does emotional intensity feel like? Like that I actually remember part of the question. It feels different for everybody. Some of us don't have alexithymic difficulties and don't have significant interoceptive difficulties, so we do feel it building up. But we might have an attentional difference that's like, I know I'm getting anxious, but also my attention's over here because that's more salient right now. And then all of a sudden the anxiety is at a level that it overtakes the thing that's dominated my attention, and I appear to have suddenly had a really big response. That applies to the anxiety around rejection as much as to anger or to other anxieties. So in rejection sensitivity, it can feel like a little thing is read through the lens of a past experience of many rejections. And then my emotions, either I don't notice them building or they just bounce high through impulsivity, emotional impulsivity. Suddenly I go from, oh, hey, how are you, to you're like, I'm okay with a funny tone, and I experience significant rejections. I perceive significant rejection, and I experience significant dysphoria around that.
So sort of tying into how that might be responded to, some AuDHD people get told you feel things too deeply or you're a lot. So can you speak to that?
So the feeling things too deeply, I think, really taps into that past history. There's a technique called the affect bridge that I'll use to demonstrate this point, and it's where if you have an anxiety now and we're not sure where it came from and we want to try and process that, I can say to you, call up the image, a mental representation. I don't like using the phrase mental image because a lot of people either see in different variations of pictures, or some people don't think in pictures at all.
Mm-hmm.
So that mental representation of the experience recently, I get you to tap into all of your senses to make it as real for your brain as possible in the now. And then I get you to tap into the emotional, that interoceptive kind of the emotional experience as you're recalling that. And then I say, let the rest of that representation disappear. Keep your attention solely on the emotional content. Now, tell me about a time earlier in your life when you felt that way. And what it does is it uses the emotion as a bridge back to past experience. Usually in EMDR, we talk about the first or worst. Often it is either the first time you experienced that or the worst time you experienced that. So that emotion is a connector to all of those past experiences that you've had. So when you feel rejected now, your brain will go, oh, all of these other rejection experiences. So because they're so salient to us and there's so many to connect in, we're experiencing a much bigger emotion because it's connected to so many more past experiences. I don't know if that answered the question, but I hope it touched on.
Just quickly, do you think that also ties into the anticipation of being rejected, sometimes feeling worse than the rejection itself?
So I think the anticipation of being rejected can lead to dysphoria because of that, absolutely. And then the rejection, whether the rejection happens or not, doesn't change the experience of what we call rejection-sensitive dysphoria. And I hasten to point out rejection sensitivity is a construct that's quite well accepted. Rejection-sensitivity dysphoria is more of a conversation in community. It's not a formal diagnosis. Pardon me. It's a lived experience that we recognise as being truly impactful on people. And when we sit with that lived experience, we often see that it does come from both a complex stress history, but also those cognitive differences that underpin a lot of our neurodivergence, the impulsivity or difficulty managing impulses, the attentional differences we have where the most salient thing has more control over our attention than we appear to. And I'll leave that there.
So we've spoken before about it feeling going from 0 to hero in intensity. How does that tie into maybe people-pleasing or self-sacrifice?
So, let me count the ways. Let me think of the most succinct way to answer this, which is not my go-to. How does that sort of history and rejection sensitivity play into people-pleasing? So first of all, I'd start off with, I do not have an issue with people-pleasing at all. I'm a people-pleaser for a living. As a psychologist, my job is to make people, or to try and assist people in having a better experience of their life in their context. That is a people-pleasing. I think when we talk about people-pleasing more broadly, what we actually mean is self-sacrifice. When I'm meeting your needs, without meeting mine anyway, and often without a real sense of agency in that. Often it's not, I'm choosing to self-sacrifice because I have the privilege to. It's more, I feel that I have to self-sacrifice to keep myself safe. So if I've experienced social exclusion my whole life, then I might feel that for me to be included, my social needs don't need to be met, or they need to be deprioritized because I have to keep you feeling important or prioritized. And in so doing, deprioritize myself for me to be included. And when I do that across my entire life, it is a contributor to all of the stress and masking and the burnout ingredients that lead to autistic burnout and the significant difficulties in recovering from that.
So you've talked in previous episodes about AuDHD thinking overlaid with interpersonal stress, looking a lot like borderline characteristics. Does rejection sensitivity feed into that same pattern?
So I think, absolutely. I think that I've talked also about sort of an AuDHD state of mind before, where we tend to think not just about the thing immediately, but about the orders of effect, the things connected to that. It's not, I've got to take my computer to the shop to get fixed. It's, I've got to take my computer to the shop to get fixed. And if I'm in burnout, for example, it's, but then I've got to get up, and then I've got to have a shower, and then I've got to choose clothes, and then I've got to dress, and then I've got to work out how to get to the new computer shop because my old computer shop's closed. So we're not thinking about a simple task like I've got to get to the shop. We're thinking about all of the little tasks in between now and then, and them all as one massive thing. So that can become problematic. I have lost my train of thought. What was the question again? Sorry, I found it again.
Yeah.
Thank you so much. So that kind of AuDHD style of thinking in rejection sensitivity, if I have that past history, so I'll bounce back to the borderline description to give a bit more context for people who haven't seen that episode or listened to that episode. So, and by no means do I suggest that borderline does not exist exclusive of this. However, there are a number of people that I have come across clinically and personally who have been diagnosed with borderline personality disorder. And when we look at their characteristics and their expression of their neurodivergent characteristics in the context of their early life or chronic or ongoing interpersonal stress and trauma, it expresses very much as borderline personality disorder expresses. And arguably what we call personality is probably the expression of cognitive characteristics in a context, but that's not a evidence-based research thing. That's literally my observations. So that's the kind of framework we're looking at here. Now, looking at rejection sensitivity, can that work in the same way? I would say yes. And rejection sensitivity, we do actually see that experience in a lot of people with borderline personality disorder. Borderline comes with this central self-belief, self-concept that I'm broken and I'm not good enough and, I'm excluded and rejected, and I fear that rejection. So I do what I need to do to be included. We talk about idealization and devaluation in borderline. And as long as you kind of make me feel good about myself, and this is not people being deliberate about this is a defensive structure that's been built up. As long as you make me feel good, I think you're amazing. I paint you as an angel, but if you disagree with me, then you kind of feed into this negative self-belief and you reinforce that, and you suddenly become a demon to me. And that must be so hard. That's such a difficult space to live in for people. And I don't want to buy into this dreadful narrative about borderline people being somehow bad people, because they're not. They're people with a really significant history that's they're doing their best to manage. It just happens to be hard for the people around them. So rejection sensitivity in borderline and outside of, very much the same thing, because my rejection anxiety that leads to that sensitivity is also related to my self-concept and my self-esteem. How valuable do I think I am to other people and myself? And how whole do I think I am? If it's a negative response or an unhelpful response to both of those, then my anxiety is going to fill in the gaps, and I'm going to read ambiguous situations through the lens of exclusion and rejection. But I'm also, as discussed, I'm not only just primed to see the rejections and to read ambiguous cues as rejections, I'm also more likely to dismiss positive social cues. I'm going to walk into a room, see 3 people looking up and frowning, or looking up and looking away, and read those as rejection, and miss the 2 people that looked me in the eye and smiled, probably because I have some social anxiety as well, so I looked down and didn't see their eyes. I'm doubly more likely, quadruply likely, to actually experience rejection. One part through actual rejection, one part through non-rejection that could have been rejection, ambiguous, and one part through not receiving that positive inclusion cue.
So you've talked about the NICE framework before, the interest, challenge, emergency.
I love the NICE framework. It makes me moist, hey. It makes me so happy.
For anchoring ADHD attention, can the same framework be used for emotional dysregulation?
So absolutely, and I love that. I love the throwback to anchoring attention to the ADHD is out there: novelty, interest, challenge, and emergency. And if we think about those things, we can actually tie a bit of them back into that conversation about emotions and our body's response to our cognitive appraisals. But I'll leave that link there. If anyone wants to send us an email or question that one, I'm happy to answer. It's really good for those of us who are not importance-based with our attention. We're more salience-based. And by that I mean planning an organisation requires me to notice what are the important things to do right now, and prioritise those. Salience-based attention, or interest-based attention, sometimes we call it. I see the thing that stands out to me right now. That's what my attention goes to. As ADHDers and AuDHDers, we are innately really good at, whether it's through disorganisation or whatever the cause is, getting to the last minute and having to do the thing really quickly, really suddenly. That's the emergency part of the NICE framework. That's anxiety kicking in. I need to get it done so I can anchor my attention. It's making the thing the most salient to me because there are repercussions. But I can use novelty, new things, I can use interest, and I can use challenging things that are growth challenge, not anxiety challenge. So that's to anchor my attention, which can help motivate me. In the context of rejection sensitivity or big emotions that a lot of us can have regardless, if anyone's wondering about the noise that I just make, it's because a dog says he's just sitting on Dan's lap and is being gorgeous, and Dan is
slightly kicking me.
Beautiful job of managing being kicked by her while she's being all cute on their lap. So, it's the NICE framework. Not only can it be good to anchor our attention and motivate, when I've got big emotions, for a lot of neurodivergent people, just calm down is the opposite of help. Just bring your attention to your breath can actually be really triggering for some neurodivergent people. Just, ground yourself can be really unhelpful because, again, salience-based attention, the biggest problem right now is the thing that's made my emotions big. But we can divert my attention to something that's novel, interesting, or challenging, rather than something that's threatening, rather than the emergency. We can divert my attention to, a lot of the people that I work with can have such significant anxiety. And I'll use an example of my own where we don't want to look stupid because that's threatening. I will never ask a dumb question, if I perceive it to be a dumb question, in a class for myself. However, if I see you struggling with an idea and it's clear to me what the idea is, I'll put my hand up and ask so I can do this thing for you that I can't do for myself. I think it probably taps into what we call the justice orientation, probably taps into the focus that a lot of us have on contributing to community. There's something there. It's probably what made me want to become a psychologist. I've had some shit times, so I wanted to try and make sure that other people had a minimised risk of having the same shit times. We can use that. If somebody's emotions are really big, but they're really community and care of others oriented, we can divert their attention to something that they find rewarding and will also anchor their attention to help bring those big unhelpful emotions down. Or we can use novelty or interest as well. And it can help as emotional regulation that's not use some mindfulness or breathing retraining or attentional distraction.
Now, we discussed this last night, and I thought it was a really good... The discussion we had was really good. If we could retire one phrase from the way people talk about neurodivergent emotions, what would it be?
It's you're too much. You're not too much. Like, I said it last night, sort of jokingly, but also, if I'm too much, does that not also mean that you're too little? Like, it's not about anyone being too much or too little, really. It's about differences. And if you're in a room full of people who say you're too much, I wonder how bored you are in that room. And pop on over to ours for a cuppa. Like, come on into our clinic and have a chat. Move in spaces with community. That comes with its own exigencies, its own difficulties, because sometimes when you've got 5 emotionally impulsive people in a room, that can lead to conflict. If we're also 5 respectful people who go, oh, actually, I can feel myself getting really angry, so I'm just going to take a breath and we can come back to this in a minute, can actually be really helpful. One, in doing that, we can model that for community who might not have had that before. We can also just feel like the normal that just doesn't exist, actually. We can feel not excluded, not like something that's on the outer. We can recognise that within community, we're not too much. Within community, we're usually just right. The thing I love about the neurodivergent community is I work with some people who I absolutely adore, and I think I would love to put you up on a pedestal and go, look at this person for this and this other person for this. And these people that I really resonate with have such different characteristics, and I think the The benefit of being around community is we also find that we don't have to be set in a particular box to be socially appealing or socially attractive to other people, because community is community. The general community kind of has some expectations, and we have expectations of it. But our own community, we tend to be more liberal, more open. Clock that, check that one. We can also be much more closed in some ways, but we tend to be more forgiving about the neurodivergent people and our quirks, because we have quirks too, and we're like, oh, you're quirky like me.
I see that.
Yeah. I love this phrase that a lot of people use lately, and that's like neurokin. Oh, neurokin. you are the sibling of my brain. And that was a lovely, we're almost at time.
Yes.
Find out there.
So the final question, for the people or anyone listening right now who maybe just heard themselves described accurately for the first time, what's one small concrete thing they can do this week that allows for some self-compassion?
Self-compassion. Remember that if you're experiencing rejection sensitivity, for example, remember that this is not a thing that's just come out of nowhere. Remember that you've experienced similar things, again, real or perceived, and you probably haven't experienced the positive social feedback because of what we discussed earlier. And you're just a person responding in an understandable way to your context. You're not too much. Does the response sometimes not serve us? Yeah, sure it does, but it's not coming out of nowhere. It's coming from somewhere that we can probably track if we look hard enough, and recognizing that that just makes you human, like everybody else in the world. And in that we are included, because everybody can be a bit extra from time to time. So just, honour you and who you are, and the fact that you're not doing this on purpose. You're not trying to make the world inconvenient to the people around you, which is the implication of you're too much. Said it before and I'll say it again, you're just the right amount.
Awesome. Thank you.
Well, on that note, it's come to the end of this week's chat/monologue/deviation from deviation tangents. Thank you, everybody, for listening in again, and we look forward to a chat next week. See ya.